Hello, I am back again, and this video is actually on a specific surgery used for pseudotumor cerebri, or benign intracranial hypertension, or idiopathic intracranial hypertension that I have not had, but this has been proposed to me by my neurosurgeon, and it is possibly the next step I may be looking at. As of right now, I have not decided to take this step. This neurosurgery, and this is why I bring it forth, I have actually been considering quite seriously, is called ICE. And I mean by ICE, I mean ICE, that's the acronym, and ICE for internal, C for cranial, E expansion. So this is internal cranial expansion surgery. The reason why I'm looking at it is because I actually have the journal article in front of me. So this is a journal article. I will put the PDF in the website so that you can pursue this. And this is I believe it's a journal article from neurosurgery in pediatrics. This surgery is actually as of when I am aware of this, of done my research, used more in children than adults. And please do understand that what I am telling you is, again, my experience. It is not by any means medical advice, or it is not trying to lead you in any direction, whether being that you should do this, not do this. I am just letting you know what my experience has been and what I have found out or known about this surgery called ICE. So this surgery is or was presented to me. My understanding is that it was presented to me as a last resort, because other surgeries and medication for the pseudotumor cerebri were not working, and I continued to have vision loss after one of my eyes is completely blind. Hence, due to a lack of resources, this surgery was presented to me, and this surgery basically entails quite a big process, because it usually takes between 10 and 12 hours. 2 teams of neurosurgeons, and what happens is basically the large majority of the top of your skull gets taken off and filed down. Basically, the goal of it is for your spinal fluid to have more space to go. And what I mean by that, by the top of your skull, is there is a nice diagram on the journal article that was published in July 2012 by a group of the group of neurosurgeons that first sort of pioneered this surgery. Now, I shall warn you that in this, if you look at the original article, there are some online. The printed version is in black and white, but the one online has some graphic photographs. So I am warning you, if you are visually sensitive, that it can be impacting. The photo, the graph I'm about to show you is not, but letting you know I'm about to show you a graph. But this is basically, let me see, this is basically what happens. In other words, 4 pieces of skull are taken off, and then neurosurgeons proceed to shave the inside of those 4 pieces. Then they put them back on the skull of the patient. They actually nail them down. I was told that depending on my case, they might even leave a little bit of a bone open. for the fluid to have space to go. I was also told that in most cases, due to the surgery, the nature of the surgery, most patients need to have a blood transfusion, and many of the patients have had to have another surgery within 24 hours, because usually there is a shunt still, a VP shunt placed just in case during this surgery. So it is quite a complex surgery, as you can tell. There have been, and I urge you to ask questions like, what are the results? What is the rate of long-term success, and what are the side effects? I was given the choice, since a blood transfusion was needed, if I wanted to, throughout the course of the month previous, to actually donate my own blood, and my own blood would be held so that I would be transfusing my own blood. So there were many different aspects to this surgery. Like I said, to this date, I have not gone ahead with the surgery. It is still an option hanging over as a viable option, as something that it may eventually happen. But it is a surgery that it is quite involved. One point I do want to make before I end this video is that one of the reasons why I haven't gone ahead is because one of my understanding is that there has been reported post headaches due to the fact that the bone needs to be nailed in again. I call it nailed in. Probably not the best language to use, but due to this, the fact that it has to be put back in, and how there have been patients that have reported post headaches, and I thought, I don't want to trade one headache for another. I'm not saying that this is severe or that this would not be a reason to do it, but it has been reported, is again my understanding. As you can tell, I'm being very cautious because I want to make sure that you understand I am just giving you my point of view at this time. So thank you. This has been a video about ICE, the Internal Cranial Expansion surgery. I hope it has helped you in giving you a little bit of an understanding on another option yet on this condition. And I wish you best. Thank you.